Have you guys heard of Teachback?
What's Teachback?
Teachback is a new way of educating patients where they have to state to you in their own words what you're teaching them about. Studies have shown benefits, especially for patients recalling information.
Allina has begun work with the Institute for Healthcare Improvement to improve patient education. The focus was to study heart failure patients at Unity, but what we have found can be applied to all patients. The first thing we learned was that we tend to teach in too much detail.
In the next few minutes, you're going to see demonstrated the Teachback technique. Many of us learned in medical school and nursing school how important patient education is. One of the things that we don't really realize is that only about 50% of what we teach patients is retained. So by the time my patients leave my office and end up in the waiting room, half of what I've told them has been lost.
Now here's your copy of the after-visit summary that we just went over. Now I want to be sure that I did a good job explaining about asthma and your inhaler. What will you say to your family when you leave the clinic today?
Well, they know I had the appointment, so they're going to want to know how it went, and I'll just have to let them know. The doctor says I have asthma and that I need to start using an inhaler.
Yep, that's right. Can you tell me a little bit about asthma? You can start, and I can fill in some details.
Sure. From what I understand, my lungs get clogged, and it makes it hard for me to breathe sometimes. And one of the things I've been told to stay away from are smokers.
That's right. Let's take a look here at your after-visit summary and then also this packet called Managing Your Asthma. And you're right. Asthma can cause the airways in your lungs to get inflamed and constricted, making it hard to breathe. But your inhaler will help things open up so you can breathe a little bit easier.
Okay.
And I'm glad you mentioned smoking. Staying away from smoking is the right thing to do, along with staying away from these other things listed here in your packet. These things are called triggers. And can you think of any other triggers that might be around you?
Yeah. One in particular, our neighbors, we do a lot with our neighbors, and they have 2 old English sheepdogs, and they're always with them. And when they come over to our house, those dogs always are leaving big clouds of fur behind, so I'm sure that's something I'm going to have to start keeping an eye out for.
Yeah, that's right. Sounds good. Now, you said you worked full-time?
Yes.
Okay. When do you think you'll be able to use your inhaler?
Well, I plan on using it in the morning when I get ready for work, and then I'll plan on taking that second dosage when I get home from work in the evening.
That's perfect. That's exactly what the doctor has written in your instructions here on your after-visit summary. And also on this after-visit summary, you can find the steps that we went through on how to use your inhaler.
Okay. No, this will help, because I know when I leave here I'll probably forget half of it, and I know when I tell my family I'm going to have to start using an inhaler, they're going to be asking, well, how often are you using it? And I'll be able to show them this and let them know exactly what I need to do.
That's a great idea, to have this and this packet out and available for you or your family to grab if you need to. That's great. Now, before we leave, would you show me how to use your inhaler?
Sure.
Looks like you got it. Now, feel free, if you think of any questions, definitely call the clinic.
Sure. Thank you.
You're welcome. The Teachback method, also known as the Show Me method, validates the patient's clear understanding and also allows us to evaluate how well we gave the information.